My name is Sarah Kipps. I'm a reproductive sexual health nurse and I work in services in South London. We have two main tests for HIV. We have a finger prick point of care test. This gives an immediate result, but the result is reactive and needs to be confirmed by a conventional blood test. We also have a conventional blood test and the result is received within 5 to 7 days. The blood test is the most accurate test as it confirms the presence of both antigen and antibodies, which confirm the presence of infection. The patient will be called by a health advisor and asked to come in for an appointment where they will discuss treatment options and support that they may receive at the clinic, as this is a lifelong infection and they will need ongoing support and treatment. There's a specialist team within the sexual health department which specifically deals with people with HIV infection. These include a medical team of doctors, nurses, and also health advisors who offer counselling and ongoing support to patients with HIV. They can also signpost patients to support groups. The main treatment for HIV is antiretroviral therapy. The aim of this therapy is to reduce the virus present in the system and reduce the incidence of AIDS-related illnesses developing. Because antiretroviral therapy is very effective, HIV is now seen as a chronic illness which can be managed effectively and patients are leading a normal life. However, patients who present late usually have a high viral load and are much more at risk of AIDS-related illnesses and their outlook is much poorer. Pharmacists need to know that self-testing kits will be available from the 14th of April for patients to access. They need to know how these tests work and they need to be familiar with the packaging and the results. They also need to know that if the test comes back, it will be a reactive test and this needs to be confirmed in a clinic by a proper blood test. Pharmacists need to know about local services and how to refer their patients. Pharmacists also need to know that there is a window period. If someone is infected, it can take up to 3 months for the infection to show in a blood test. Pharmacists should be aware that a patient may have a false negative result if they attend within the 3-month window period since contracting the infection, and they should repeat this test. The patient should be advised to repeat the test after 3 months since the unprotected sex.